My name is Dr. Wang. I'm the glaucoma and cataract specialist here at Harvard Eye. Today, we're going to talk a little bit about an eye disease called glaucoma, which is an irreversible eye damage. Glaucoma, unfortunately, unlike cataract, is an irreversible eye disease that can progress with aging. Other risk factors for you to increase your risk of getting glaucoma would include family history, increased eye pressure, chronic inflammation in the eye, major trauma to the eye, and potentially other systemic diseases such as autoimmune conditions and diabetes.
Behind each eyeball, there is an optic nerve that connects the eye to the brain, just like I can show you on this eye model. We're looking at an eye straight ahead, and we put the eye in half so we can see the inside of the eye. At the very back, the structure you're seeing, that's kind of like a cable that connects the back of the eye and link it all the way to the brain, is actually the optic nerve. And this is the structure of interest when it comes to glaucoma. So as we get older, this optic nerve deteriorates just like the rest of the body. It physically becomes thinner and thinner over time. And if it's within a certain slow rate, it's expected. But if we notice the deterioration rate of this optic nerve becomes a little too fast, that's when we start to worry, hey, this might be glaucoma starting to happen. So most of the time, we also connect glaucoma with a measurement of the eye, which is the eye pressure. Eye pressure is a independent measurement of the eye, has nothing to do with your blood pressure for the most part. As the eye pressure increase, it can start to exert extra damage onto this optic nerve and making that aging deterioration process faster and faster. So it'll get to a critical point where the optic nerve cannot perform all the function we asked it to, and that's when we start to have problem with our vision. But the most deceiving part of all of this deterioration is that glaucoma is not going to give you much symptoms. So if doctors wait for patients to come in and say, hey, I feel like my eye is more itchy than usual, more discharge, or if I feel like my eye's more tired, I can't see the small prints, or I can't drive, those are usually not caused by glaucoma. Glaucoma is such a silent theft of our vision that it steals away your vision one little bit at a time, and from the very edges first. So it'll be tiny pinpoint losses on the far edges of the vision, and slowly it can close in to give people tunnel vision. So put that into real life perspective, you can actually have restriction in your peripheral vision and not know, because we have two eyes covering for each other when you have both of them open. And we're very used to noticing things on the side by turning our head to see where you actually bring the object into your primary or straight ahead vision. But if in people with severe glaucoma and their vision is restricted, very narrowed into the center, you can easily see this becoming a dangerous situation when you're driving. You can get T-boned in a car accident where you're not seeing things coming from the side. You can miss the step going downstairs and not noticing there's an extra step there. So practically, as we get older, and again, this is an aging issue, these things become actually very relevant to our everyday practice, which is why we like to screen people as early as possible to try to prevent things from getting worse or stop it from getting to a point where it affects your activities. Once you notice there is already restriction in your vision on a practical daily standpoint, that's usually too late, which is why we like to screen people as early as possible so we can detect problem as early as possible and start intervention when needed. Any of the glaucoma damage, if it were to happen, remember I told you it's a nerve damage from the beginning, it's not reversible. So that's why we try to catch it as soon as possible to stop it to a point where we cannot do much anymore. So for these reasons, whenever your optometrist, even when you just go there for glasses, or your primary care doctors may send you to glaucoma specialists very early on in order to establish a baseline. And from the baseline, we monitor over time to compare to the original, make sure we're not noticing any progressive damage.